My name is Amir and I'm here at Williamson Medical Center in the lab, and we're going to show you what we do here. We get a sample of your blood and we're going to check to see if there is anything wrong with you, so we can tell your doctor what's wrong with you, so the doctor will give you the medication to get you well. We run all kinds of tests, anything from your blood sugar to fat in your blood to any viruses that you may have. We check all of those and we give them to your doctor, and then the doctor gives you the medication that would make you well. And I like what I do is mostly because without what we do here, the doctor would not be able to diagnose what's wrong with you. So in a way, we work as a team with a doctor to really get you well and get you back to your school, to your family, where you can enjoy your life.
I'm Evelyn Barber. I work for EVS Environmental Service. I clean, housekeep, help take care of the patients if they need anything besides, medical attention.
I'm Donna Dukes. I'm an environmental services aide. So I would recommend it to really anybody, but young people, they need to know how to care for somebody, to go into a room with an elder person and they just grab your heart. People need to know what it's like to work here, how rewarding it is. The thing I like most about my job would be interacting with the patients.
It's a good way to understand how older people need care. They don't just need medical care, they need somebody to talk to sometimes. It's a very important job. We keep everything clean and disinfectant and help the patients as best we can.
If I didn't do my job well, there would be a risk of germs, from one patient to the next. We have to really take good care of the patients and make sure that their rooms are very clean and taken care of. There's a lot of people in here that's so nice, so very nice, and I enjoy working here.
Hi, my name is Beverly Hecht. I'm a certified surgical tech and a certified surgical first assistant in surgery. A certified surgical tech plays a very important role in the operating room. They make sure that we have all of our instrumentation and supplies ready for the procedure. They open up the surgical supplies and prepare the room for surgery. Intraoperatively, the surgical tech observes and protects the field from contamination. They pass instruments to the surgeon and the assistant in a timely manner. The surgical tech also is responsible for counting instruments and sponges to make sure that they're not left in the patient. I started working at Williamson Medical Center 6 years ago and decided to further my education as a certified surgical first assistant. As a first assistant, I work one-on-one with the surgeon by performing the actual surgery. My training allows me to cut, cauterize, ligate vessels, and sew the patient. It's a huge responsibility, but during my career, I've had the opportunity to hold a human heart, touch a brain, and deliver a baby. I love my career. I couldn't imagine doing anything else for a living.
I'm Eric Sorensen. I'm the field training officer for Williamson Medical Center. And what I do is I do ongoing training for security officers, and I also train new officers. And we have a rigorous training program. Here we have almost 100 cameras that we keep running full time, that we observe sometimes, and then sometimes we have to look at the recorded video. You do have to have good skills in communication, spelling, grammar, be able to write clear and concise reports. You have to be able to interact well with people. We do several things here in security. We observe, we detect, we deter, and we report what we see and observe. I think one of the most fun parts of my job is when I'm able to actually make a difference and help somebody. Most of the people that come into the hospital, they're either not feeling good or they may not be in the best of moods, but as security officers we can provide comfort and help to them, and sometimes it's something as simple as just giving them directions, making sure they get to the right place and they're not late for their appointment.